Hi, my name is Kaylee Carter. I am a registered nurse on a coronary care progressive care unit. At my place of employment, I often take care of heart failure patients. In my practice as an RN, I've noticed not only patients and family members, but fellow RNs and healthcare providers have a lack of understanding of what palliative care is and how it could benefit heart failure patients. Heart failure is a progressive and ultimately lethal disease. There are two types of heart failure, systolic and diastolic. In diastolic heart failure, there's a filling problem due to stiff or thickened heart muscle. In systolic heart failure, there's a problem with how the heart pumps blood. And you can also have systolic and diastolic or biventricular heart failure, in which both sides of the heart are affected. Either way, the heart is unable to adequately supply blood to the body. When the heart is not pumping effectively, you can develop distressing symptoms. These include swelling, dyspnea or trouble breathing, weakness, and fatigue. Treatment often involves aggressive diuresis, thirst, and dry mouth is an uncomfortable symptom of this aggressive diuretic therapy. I have had patients that just pray that God will take their thirst away because they're so miserable and just want to get better and follow their treatment plan. So these symptoms that come with heart failure, they're very distressing. They would affect anyone's quality of life. And although a nurse participates in palliative care, we adjust to improve their breathing, cool fans to improve their breathing, positioning, assess their pain, treat their pain. We provide reassurance for anxiety. Palliative care can also help and be a long-term resource for patients with this diagnosis. Palliative care is a resource for anyone living with a serious illness, in this case heart failure. Palliative care can help patients and family members make treatment goals and stay informed of their treatment plan. And although this resource could be beneficial for heart failure patients, there is not a consensus of when to consult palliative or a standard model for referral times. This ultimately leads to delaying palliative care until a patient is opting to receive hospice or full comfort measures. According to the optimal model of palliative care for patients with advanced heart failure, timing of referral should be when patient develops New York Heart Association, NYHA Class 3 or 4 symptoms, or American College of Cardiology, American Heart Association, or ACC-AHA Stage D disease. The NYHA classifies the extent of heart failure. Class 3 is marked by limitation in activity due to symptoms and only being comfortable at rest. Class 4 is severe limitations with symptoms even at rest. ACC-AHA provides a heart failure classification. Stage C is patients who have developed clinical heart failure. And Stage D is patients with refractory heart failure requiring advanced interventions. Although this is a chronic disease, it is marked by exacerbations and remissions, so prognosis can vary, sometimes making it hard for a provider or nurse to talk about palliative care with the patient or family. Some sources recommend the optimal time for a palliative consult is at diagnosis. According to the National Institute on Aging, palliative care is a resource for anyone living with a serious illness such as heart failure. Palliative care can be helpful and provided at any time during a patient's illness, and the optimal time being upon diagnosis. Palliative care can be provided along with curative treatment and does not depend on the prognosis. A hospital in Canada, North York General, has actually formed an initiative for early palliative care in advanced heart failure, known as a new model of care and integrated approach to palliative care for patients with advanced heart failure. This hospital actually created a supportive cardiology team with program goals to increase advanced care planning, decrease emergency department visits, reduce recurrent hospitalizations, and also increase staff, patient, and family satisfaction. With this management, they have found an increased number of goals of care and advanced care planning discussions and positive feedback from patients and their families, as well as the cardiology team. The first step to implementing a change is to identify barriers. In this case, the barrier to lack of providing this resource to this patient population is the need for more education on what palliative care is and how it could benefit this group of patients. One misconception I see a lot are palliative care and hospice care are the same. There are differences between the two. Hospice is a type of palliative care for patients with a limited lifespan. And although both services are aimed at providing comfort and relief of symptoms, palliative care is for people at any stage of an illness, and the condition does not even have to be incurable. In order for this service to be more utilized for the heart failure patient population, the patient's family members and staff members should be educated on the mentioned information. A lot of patients don't realize the severity of what a heart failure diagnosis means. 50% of heart failure patients will die within 5 years of their diagnosis. I know I, as a nurse, would not feel comfortable telling a patient this, even though it's a fact and the evidence supports this statement. But with an awareness of the severity of this disease, they should be allotted resources to cope with the symptoms and treatments that will come along with this diagnosis for the remainder of their lives. I and other healthcare providers can make a difference by educating on the severity of the disease and also educating on what resources they have available to them to make the most informed choices and improve their quality of life. Because it might just be a statistic to us, but this is a reality to this patient population, and they have to live with this, not the healthcare provider or the nurse. I will provide education on palliative care through utilization of a pamphlet or flyers and also word of mouth. Spreading awareness can make a huge difference in promoting this resource, doing what is right for our patients, and providing the best possible care for this patient population. Assessing a patient's goal of care is a focus of palliative care and can be measurable by interviewing the patient and seeing if their expectations of care are actually met. Living up to the patient's goals of care can also improve the healthcare provider's satisfaction of care provided, as they are making a difference to the patient's quality of life. Certain outcomes, such as palliative consults ordered, staff satisfaction, and patient satisfaction with their goals of care, can be assessed and measured to evaluate the efficiency of providing education on palliative care for heart failure patients.